Hey everyone, and welcome back to the deep dive. Today
Mhm.
we're going deep on ICL.
ICL.
Yeah, implantable collimer lens.
Oh,
So we had a listener write in who's really curious about it, and I gotta say I'm pretty intrigued too. It's like this whole other alternative to LASIK or Smile.
yeah. It's definitely a really interesting option, especially for people who maybe aren't the best candidates for those kind of more common procedures, like, if they have really high myopia, like very nearsighted, or if their corneas are thin.
Yeah, and you know what else is kind of wild? There's an ICL now with a tiny hole in it.
I know, right?
We'll get into that, I
Yeah.
promise. Plus, we found some research showing like changes in anxiety and depression levels after ICL surgery.
Hmm.
And then we'll even get into AI. Like AI is being used now to size these lenses.
Oh, wow. That's pretty futuristic.
I know, right?
Yeah.
So, okay, first things first. What is ICL? Like, can you give us the non-med school version?
Yeah. So basically imagine a tiny lens, right? It's biocompatible, of course, and it gets implanted permanently into your eye.
Permanently.
Permanently. And it's designed to just correct your vision. And it's different from LASIK because LASIK reshapes your cornea, but with ICL, it actually works with your natural lens.
Oh, so it's more like adding something to your eye instead of like changing what's already there.
Exactly. Yeah. Yeah, that's a really good way to put it.
Ah,
And that's part of what makes it such a good option for people with high myopia or thin corneas because they might not be suitable for LASIK or some of those other procedures, so this gives them another choice.
that's cool. Okay, so speaking of choices, how much correction can ICL actually do? I mean, it must be pretty powerful if it can handle those more complicated cases.
Oh yeah, it's pretty impressive. ICL can correct up to negative 20.00 diopters of myopia, and then up to 5.00 diopters of astigmatism too.
Wow. Okay. That's a lot.
Yeah.
All right, so I have to ask about this whole hole in the lens thing. It just sounds, I don't know, kind of strange.
Yeah. Well, so that's the EVO ICL. It's a newer version, and yeah, it has this little tiny 360 millimeter central hole. It's called centroflow technology.
Okay. 360 millimeters. That's tiny. But why a hole?
So before the EVO ICL, surgeons would have to do this separate procedure, an iridotomy.
Iridotomy.
Yeah, and basically it created this small opening in your eye so that fluid could flow through properly. But with the EVO ICL, this little tiny hole just lets that fluid flow naturally. No extra procedure needed.
Oh, so it's like less invasive.
Exactly. It makes the whole thing simpler and potentially safer.
Yeah, that makes sense. Okay, but like, wouldn't that hole mess with your vision?
Nope. It's so small. Think like smaller than a period at the end of a sentence.
Oh, wow.
Yeah, it really doesn't interfere with your vision at all.
Huh. That's pretty cool.
Yeah, and it just goes to show how they're always coming up with new ways to improve these procedures.
Totally. Okay, so you mentioned earlier that there's research connecting ICL surgery with changes in anxiety and depression. Can you tell me more about that?
Yeah. So there was this study where they used standard psychological scales
Hmm.
to measure people's mental state before and after ICL surgery, the SES and the SDS,
Yeah.
the self-rating anxiety scale and the self-rating depression scale.
Got it. So they had like a baseline to compare it to.
Right, exactly. And what they found is that both the anxiety and depression scores, they decreased significantly after people had the ICL surgery.
Hmm. So better vision, better mood. Like, is it really that simple?
Well, it might be a little more complicated than that. I mean, think
Yeah.
about it. Clearer vision can make you feel more confident, right?
Yeah.
And then you don't have to rely on your glasses or contacts as much, and maybe you even have less eye strain and fewer headaches. So all these things, they could all be contributing to making people feel better.
It's fascinating, isn't it? Like the connection between our senses and uh, our mental well-being.
For sure. There's definitely a lot to think about there.
Okay, so this next one's going to sound a little sci-fi, but AI is being used in ICL now too. How?
I know, it's pretty wild. Basically, they're using AI and machine learning to create these algorithms that can predict the best ICL size for each patient.
Really?
Yeah, it's all based on their own unique eye characteristics, so it's like, super customized.
So AI is basically like a matchmaker for ICLs.
Yeah, a super precise one.
That's so cool. What's the point of all that precision? What is it like? What does it change?
Well, I mean, the hope is that it'll lead to fewer complications, right?
Yeah.
And even better vision for people, the best possible outcome. So it's a really exciting area of research.
It sounds like it could totally revolutionize ICL.
Yeah.
But even with all these advancements, ICL surgery is still surgery.
Right.
So there are risks involved, right? What are some of the things people should be aware of?
Yeah, so you're right. It's really important to keep in mind that, just like with any surgery, there are some potential risks with ICL too.
Right.
So while it's generally considered safe, some things that can happen are increased intraocular pressure, which can lead to glaucoma, and there's also a chance of developing cataracts. And then in some cases, the lens might need to be repositioned or even removed, but that's pretty rare.
Okay, so it's definitely not a decision to take lightly. Sounds like you really got to do your research and, talk to a doctor.
Oh, absolutely. It's super important to talk to a qualified eye surgeon so you can understand both the risks and the benefits, before you make any decisions.
Right. Well, speaking of finding a surgeon, our listener specifically asked about finding a great eye surgeon in Lahore,
Oh,
Pakistan.
right.
And, we can't give medical advice or anything, but we did do a little research on who's considered, a leader in the field there.
Oh, that's great.
Yeah. And one name that we saw over and over again is Professor Dr. Suhail Sarwar. He seems to be pretty well known in Lahore, especially when it comes to ICL.
Oh, that's good to know. And it's always great for people to have a starting point.
Exactly. But it's important for a listener to remember that this is just a starting point. They should do their own research too.
Absolutely. Check credentials, read reviews, all that good stuff, and maybe even get a second opinion.
Yeah. It's all about, being proactive and making sure that they're comfortable with whoever they choose.
For sure. And it's exciting, there are these great options out there like ICL that can really, improve people's vision.
Definitely. I think we've covered a lot of ground on ICL today, from what it even is to the EVO ICL and those psychological benefits. But before we run out of time, I want to talk about something I just found while we were prepping for this episode. Did you know that they're looking at using ICL for vision correction in space?
Wait, what? In space?
I know.
Wow.
I mean, imagine astronauts getting ICL before a long mission so they wouldn't need glasses or contacts up there.
That's wild.
It's it sounds crazy, but it could actually happen. It just shows you how far this stuff can go.
I know. It's pretty amazing to think about.
Well, for our listener, hopefully this deep dive has been, helpful and interesting.
Yeah, and hopefully a little bit inspiring, too. I mean, we covered so much.
I know, but we just scratched the surface. There's so much more to explore with ICL. What really caught your attention? The technology itself, the benefits, or maybe the ethics of using AI in medicine.
Right. There are so many different angles to this.
We want to hear your thoughts. So keep those questions coming and keep learning. And, most importantly, keep exploring the world with those curious eyes. Until next time, everyone, happy learning.
Bye, everyone.
Bye.
It's really pretty amazing how much things are changing in eye care. ICL is a great example of that. But, before the break, we were talking about the risks of ICL. It's important to, really understand what those risks could actually mean for someone if they're thinking about getting the procedure.
Yeah, for sure. So we talked about increased intraocular pressure, IOP.
Right.
Can you break that down a little more? What is it and why is it a problem?
So intraocular pressure is basically just the fluid pressure inside your eye. And if it gets too high, it can actually damage your optic nerve. And that can lead to glaucoma.
Oh, wow. Okay, so that's not good.
No, it's definitely something you want to keep an eye on, pun intended. It's really important to monitor it regularly, especially after the surgery, just to make sure that everything's okay.
So those post-op checkups are extra important.
Exactly. You got to be proactive.
Right. Okay, so another risk we mentioned is cataracts. But isn't that something that happens naturally as we get older anyway?
It is, yeah. But any surgery that you have on your eye can slightly increase that risk. You might develop cataracts a bit earlier than you would have otherwise.
So it's kind of like a trade-off then, right? The benefits of ICL versus, that slightly higher risk.
Yeah, exactly. And for a lot of people, the benefits are going to outweigh the risk by far. But, it's a personal decision.
Right. Makes sense. We also mentioned that sometimes the ICL might need to be repositioned or even removed. Why would that happen?
So sometimes the lens can shift a little bit out of place, or in very rare cases, there could be some complications that mean it needs to come out.
So it's not always a one and done kind of thing. You might need some follow-up.
Right. And that's why it's so important to, to have realistic expectations going in. Not every eye is going to react the same way to the procedure.
Yeah. Which brings us back to that whole consultation thing.
Right. A good surgeon is going to go over all of this with you, all the possibilities. So you're going into it with all the information you need.
Totally. So our listener who asked about all this was really interested in finding a top surgeon in Lahore, Pakistan. And, of course, we can't give medical advice or, like, recommend anyone specifically, but we did find a name that kept coming up in our research.
Oh, yeah. Who is that?
So we kept seeing Professor Dr. Suhail Sarwar. He seems to be, like, super well respected in eye surgery,
Right.
especially ICL.
Wow, that's great. I mean, that gives our listeners somewhere to start, right?
Yeah, exactly.
Yeah.
But, it's always important to do your own research, too.
Oh, absolutely. Check their credentials, read reviews from other patients, maybe even get a second opinion. It's your health.
Right. It's about being informed and finding someone that you feel really good about.
Absolutely. It's great that there are so many options out there now, like ICL, that can really help people see better. It's pretty incredible.
It really is. What's kind of blowing my mind right now? I was reading about how they're even looking at using ICL for vision correction in space.
Wait, in space?
Really?
Yeah. Imagine, like, astronauts getting ICL before a long mission so they don't have to worry about glasses or contacts up there.
Wow.
That's amazing.
Yeah, right?
Yeah.
Sounds like sci-fi, but who knows? Maybe someday it'll be totally normal. It really shows, like, how much potential there is.
That's so cool.
Okay, so to our listener who's been with us on this ICL journey, hopefully this has been helpful for you.
Yeah. We covered a lot, didn't we? From, like, the basics of ICL to the EVO ICL and, even the role of AI. It's a lot to take in.
Definitely. But, the main takeaway is that you should always do your research. Talk to a qualified eye surgeon.
Yeah.
And don't be afraid to ask questions.
Absolutely. It's your vision, your health.
Now, for everyone listening, we want to leave you with something to think about. Now that you've learned all about ICL, how do you think AI is going to change the future of vision correction? Like, could we see even more personalized ICL designs thanks to AI algorithms? Or maybe even AI-powered robots performing these surgeries, with even more precision. It's really a whole new world out there, isn't it?
It really is. It's so exciting to see where it all goes from here.
So keep those questions coming. Keep diving deeper into whatever interests you, and never stop exploring the world with those curious eyes.
Absolutely. Never stop learning.
Until next time, everyone, happy learning. I mean, it really makes you think, doesn't it? Like all this incredible technology, and we just kind of, take our vision for granted most of the time.
It's true. We do. We use our eyes for everything. And then you don't realize how important they are until something goes wrong.
Exactly. And that's why I think, it's so important to, like, stay informed about the options that are out there, like ICL, LASIK, or whatever else they come up with.
Right. It's good to know what your choices are.
Totally. Okay, so I think we did a pretty good job covering ICL today.
I think so. We talked about, like, how it works and the EVO ICL and all those psychological benefits and AI. I mean, wow.
I know, right? But before we wrap things up, I want to circle back to our listener who asked about all this. They were really interested in ICL, and they specifically wanted to know about finding a good surgeon in Lahore, Pakistan.
Yeah.
And obviously we can't give medical advice, but our research led us to Professor Dr. Suhail Sarwar. He seems to be one of the top ICL experts in that area.
Yeah, that's a good starting point. But finding the right doctors, it's a personal thing.
For sure.
So it's always a good idea to get multiple opinions and, trust your instincts.
Absolutely.
Okay.
Okay, well, I think that about covers it for ICL. We hope you enjoyed this deep dive.
Yeah.
Did any part of it, like, really stand out to you? Was it the technology, the benefits, or maybe, the whole thing with AI and the ethics of it all? We want to know what you're thinking.
Yeah, let us know. And keep those questions coming.
Keep learning.
And never stop exploring.
That's right. The world is full of fascinating stuff just waiting to be discovered. Until next time, everyone, happy learning.